You're welcome to this morning class on a course that is titled Advanced Clinical Healthcare Management. Course code HCM 403. Advanced Clinical Healthcare Management, as I said. The first chapter in this course is process improvements. But we cannot go ahead talking about process improvements without really understanding what we mean by process, by the word process. Process is described as a set of steps that result in a specific outcome. Process is described as a set of steps that result in a specific outcome. In other words, process means converting input into output. Converting inputs into output. What do we really understand by input and output? Input is what we put in, and output is the result of what we put in. If you are entering into a business, whatever you put into the business must bring out a result, and the result is output. Knowing fully well that in your 300 level, you might have done clinical healthcare management to some extent, and this is the advanced stage. So there are some things I will not really stress much on in this advanced course. I have told you that process is described as a set of steps that result in a specific outcome, converting input into output. I've made it easier for you by saying that what to put into anything is what we call input, and the outcome, which is the result, is what we call output. So when we are talking about process improvement is a way of adding value into what we are putting in or getting as outcome. It's a way of improving your process in anything you are doing. And in the process of doing this, you are likely to be faced with some problem. You are likely to be faced with some problems. And what are these problems? I will tag this problem as problems faced by hospital systems across the country. Problems faced by hospital systems across the country. Number one of this problem is clinical variation. Clinical variation. What happens in a particular clinic differs from what happens in another clinic. So there are variations in all clinics. You don't expect what is happening in clinic A with clinic B. You don't expect what happens in a public health institution with private health institution. Just like you having different schools. We have private schools and public schools. You don't expect what is happening in LASU as a public school with what should be happening in JPTS as a private school. So that is what we call variation, clinical variation, this time around in medical terms. So clinical variation is one of the problems facing hospital systems across the country. So if you are asked to explain your points, these are some of the things that will back it up in your explanation. Second point here is preventable medical errors, preventable medical errors. Everybody is bound to have errors in any field of study at all. But these errors are preventable. So we normally have it as a problem facing hospital systems across the country, not just Nigeria alone. There are problems peculiar to individual countries. Nigeria has its own peculiar problems. US has its own peculiar problems. UK has its own peculiar problems, but they are preventable medical errors. Okay? As part of the problem facing hospital systems across the country, we also have what we call hospital-acquired infections. Hospital-acquired infections. People come to the hospital with a case, either with malaria, for example, and they are likely to go back home after discharge of being treated for malaria. They might go home with diarrhea. They might go home with skin infections. That's an acquired infection from the clinic. That is why in every setup, there must be proper arrangements. So hospital-acquired infections is one of the problems facing our health system or our hospital systems or our medical systems across the country. Another point is delay in discharging patients. Delay in discharging patients. As the word implies, or as the sentence implies, it is easily understood. Patients that are supposed to be discharged in the morning might be discharged in the night or in the evening. Patients that are supposed to be discharged on Monday might be discharged on Friday. It may be due to so many reasons. It's either the patient fails to pay his balance for hospital bills on time. It may happen like that. Or maybe the person that will sign the discharge paper or document might not be around or may not be available as at the time he's supposed to be discharged. One or two things may be a reason for delay in discharging. So if you have to explain delay in patient discharge, some of these reasons you must have, not necessarily the reason I'm giving now. You might have some other reasons why discharge may be delayed. We also like another point here, which is going to be the last point under these problems, is dwindling cash flow. Dwindling cash flow. This is, the amount or the charges given to individual patients may not be reached as at when you want to be discharged. So that means you have to go into negotiation with the person in charge so as to know your stand or your financial stand as concerning the charges given to you. Like in our public hospitals, you are given a charge, an hospital charges, and you cannot afford it. You are likely to meet with the person in charge. You may be forced to even go ahead to see the medical director, so that in some areas you might be exempted. They might say, okay, let us drop this for him, let us drop this for her. Even in the private hospitals, the doctors can say, okay, since you cannot afford this amount, let us drop this for her, let us drop this for her. So dwindling cash flow, when the flow in cash is not really coming the way it is expected. So we can say dwindling cash flow. So it's one of the major problems affecting our hospital systems across the country. Now, I want to talk about quality improvement. Quality improvement is more or less the same as process improvement, because when we are talking about process, we are talking about input and output. So, but just put it as quality improvement. Now, the Health Resources and Services Administration defines it as a systematic and continuous actions that lead to measurable improvements in healthcare services and the health status of targeted patient groups. I repeat, the Health Resources and Services Administration defines quality improvement as a systematic and continuous actions that lead to measurable improvements in healthcare services and the health status of targeted patient groups. In addition to a practical definition, health systems need a roadmap to help to guide successful quality improvement projects forward. In the process, there is a definition I want you to get. There is something we call health catalyst. Health catalyst. What do we understand by catalyst itself? Catalyst is an agent of change, can be defined as an agent of change. So when we are talking about health catalyst, we are talking about agent of change in the health settings. Agent of change in the health settings. Agent of change in the health settings. So Health Catalyst offers a roadmap to use best practices. It offers a roadmap to use best practices, adoption and analytics together to drive outcomes improvements. Okay? There are clinical examples of quality improvement in healthcare. Clinical examples of quality improvements in healthcare. Okay, number one of these examples is pharmacist-led medication. Pharmacist-led medication. Pharmacist-led medication. This is a therapy. Okay, let me repeat that very well so that you will not be confused. Pharmacist-led medication therapy management. Pharmacist-led medication therapy management. Pharmacist-led medication therapy management. This reduces total cost of care. This reduces total cost of care. This reduces total cost of care. Okay? Another clinical example is optimizing sepsis care. Optimizing sepsis care. What does sepsis mean? It means infection. Optimizing sepsis care, that is, it improves early recognition and outcomes. It improves early recognition and outcome. Just that. That is the explanation. It improves early recognition and outcomes. This second example of a clinical quality improvement project deals with an issue well known to hospital systems. Like I've told you, sepsis is an infection. In fact, it's a major driver of mortality in the US, in the United States. It is estimated that half of all hospital deaths or mortality are linked to the infection. Nigeria is also a part of countries where people are exposed to other diseases during admission. So we want to optimize it in our care. Identifying sepsis early can be challenging as the patient's physical response presents as a syndrome of non-specific symptoms, which delays recognition, diagnosis, and treatment, all of which increases mortality rates. So all these I've just mentioned or explained are under the second clinical examples of quality improvement. Okay? Then we have a third one, clinical example. That one is boosting readiness and change competencies. Boosting readiness and change competencies. Boosting as in B-O-O-S-T-I-N-G, boosting, or you can call it boosting readiness and change competencies. This is a key to successfully reducing clinical variation. I talked about clinical variation before under a point. So this is a key to successfully reducing clinical variation. I told us we are in chapter 1, which is process review, improvement. Now, the need for quality and safety improvement performance permeates healthcare. You see, there are needs for clinical or quality performance. So we want to look at quality healthcare now. Quality healthcare, what do we really understand by quality healthcare? Quality healthcare. So quality healthcare is defined as the degree to which health services for each individual and population increases the likelihood of desired health outcomes and are consistent with current professional knowledge. Quality healthcare is defined as the degree to which health services for each individual and population increases the likelihood of desired health outcomes and are consistent with current professional knowledge. You can make use of your own word by breaking it down as a type of healthcare received under a qualitative environment. Under a qualitative environment, a type of care received by the patient or a type of care rendered in the hospital settings qualitatively or under a qualitative environment. You can explain it that way also, and you will be right. So you don't necessarily mean to cram this definition. The majority of medical errors result from faulty systems from faulty systems and processes, and not from individuals. Majority of medical errors result from faulty systems and processes, and not from individuals. I repeat, majority of medical errors result from faulty systems and processes, not from individuals. Now let's go to the aims of healthcare. When we are talking about healthcare all over the places, there must be some goals that will be attached to it. What are you going to achieve? What are your goals? What are your aims? Number one, effectiveness. You want to make your service or services to be effective or more effective. You want to qualify your service in a better way. That's what we call effectiveness. You want to make your service safe for people to use. That's another aim. When we are talking about aims of healthcare, you are also relating to safety. So that's number two aim, safety. Number three, you must be patient-centered. You must be patient-centered. What do I mean by this? You must put your patients in mind. Think about your patients. Think about how they can get better care. Number four, your services must be timely. So timeliness is part of the aims of healthcare. Timeliness. You must be time conscious. Patients or clients must not waste much time in the hospital before they get results. Another point is efficiency. The staff that will be on duty must be very, very efficient in their field. They must be ready to put in their best in their services. They must be efficient. Equitable. Every patient must be given an equal treatment. But in Nigeria today, I doubt if every patient will be given equal treatment. Equal treatment, I mean the way you will treat the council chairman is the way you will treat a councillor. Is it possible in Nigeria today? That's a big question mark. So when we are talking about equitable aspect of the aims, it has to be questioned to some extent, but it's still part of the aims of healthcare. They want to look at the aims of effectiveness and safety. Aims of effectiveness and safety. Why do you need to be effective in your service? Why do you need to bring into your service safety aspect of life? All these things are targeted through some points. And I will start mentioning the points that are being targeted when you are thinking about effectiveness and safety in your healthcare services. Number one, process of care measures. You have to measure your care, the type of care you are giving. Everything has to go with measurements. For this case, how do I go about handling this case? So you are measuring. You are thinking about how to go about a case. You are thinking about how to go about handling the case of a patient. You are thinking about what the outcome will be. So you are like measuring some things. Number two, You want to assess whether providers of healthcare perform processes that have been demonstrated. You want to assess whether providers of healthcare performs processes that have been demonstrated to achieve the desired aims and avoid those processes that are predisposed towards harm. But don't bother yourself. You can easily just say, assess whether providers of healthcare perform processes that have been demonstrated. You can stop like that, no problem. Another aim of effectiveness and safety is that it determines, you want to determine the effect of healthcare desired outcomes. You want to determine the effects of healthcare desired outcomes. I think we should be having about 12 minutes more to round up. I will stop here when I mention the last point under this. Then I will give room for questions. You want to determine the effects of healthcare desired outcomes. And the last aim here, and this is where we're going to stop this morning, is to assess the degree to which healthcare adheres to processes based on scientific evidence. To assess the degree to which healthcare adheres to processes based on scientific evidence. I want to stop here and I want to give room for questions. Question. Question. I'm expecting questions. Nígbà tí mo ṣe tán mo tẹ on mute yẹn tó ẹ ṣe wá tẹ kí n tó on mute tí mo ti give lecture already mi lè on mute wọn nígbà tí mo give lecture. Question time. Is there anyone in the house? Is there anyone in the house? Why check again? Is there anyone in the house?
Yes, we can continue.
I'm asking for questions now.
Okay.
I want to be sure there are students online.
Students, unmute yourself. If you have any question, just unmute yourself. The mic logo on your screen.
Yes.
Set the top.
I've unmuted. I've unmuted myself already. I've unmuted myself already.
Okay.
I can't get any response from the house. Hello. Mr. Yomi. Mr. Yomi.
I'm with you, Mr. Go ahead. Go ahead, you can. Ẹ ti mute ara yín àgbọ̀ yín mọ̀.
Wọ́n ti tẹ̀ báyìí.
You can hear.
Okay, okay. So I said the assignment I'm giving out now is students must make comparisons between quality healthcare and process improvement. Quality healthcare and process improvement. That is the assignment. So I'm just saying that since we Okay. Okay. All right. So since we're having just 3 minutes to go, based on the fact that we don't have any question, let me quickly say there are factors proposed by Don Abedian in measuring the quality of healthcare. Factors proposed in measuring the quality of healthcare. I will just quickly mention the factors. I may not explain it today. There are 3 factors proposed in measuring the quality of healthcare, and those factors are structure, process, and outcomes. Structure, process, and outcomes. So I will stop finally here this morning. Next lecture, I will start with the explanation of this. So I'm rounding up. Do we still have any question from the class?
Hello, good morning, sir.
Good morning.
Yes, sir. This is Mulade, sir.
Time.
Hello, sir.
Yeah.
Yeah, this is Mulade from Ikorodu Center, sir.
Okay, speak up. We have just 1 or 2 minutes more.
Okay, sir. Sir, I didn't get. There was a state that you mentioned hospital-acquired infections. I don't know whether is it a problem to clinical health care.
I can't get you very well.
You said you mentioned some state that delayed in discharging patients. Can we did you? I don't get headlines. Whether it's a problem to healthcare management.
No. Are you really following this lecture? Do you really
That's what
follow
I
this
said.
lecture?
I'm following, but I didn't get that headlines very well, sir.
Remind me of the area where I've mentioned acquired infections. Let me quickly know before my time is off. If really you are following.
Acquired infections. Acquired infections.
Remind me quickly so that I can go there. Okay, that should be under
Delayed in discharging patients. Okay.
Problems facing hospital system across the country. Are you sure you're getting this lecture right? Problems facing hospital systems across the country. I made mention of hospital-acquired infections. That is what you want to understand. Okay? Are you here? So.
Hello, sir.
Yes, I'm giving you an explanation, but I can't hear you talking.
Okay, I can hear you, sir.
So what do you want to understand about hospital-acquired infections?
They want you to throw more light on it, sir.
What light do you want me to throw on it? Acquired infections.
Okay,
infections that you get after being discharged from an hospital is a problem facing the hospital systems in our country today. Remember, the title of the subtitle is Problems Facing Hospital Systems Across the Country. And hospital-acquired infection is one of the problems. And I said this is a problem that patients carry home from the hospital. Infections that they acquire from the hospital, different from what they took to the hospital. Do you understand now? Do you understand?
Yes, okay.
Okay. These are infections that go home with you, different from what you brought into the hospital, which you have been treated for. You went into the hospital with a case of malaria and you are going back home with diarrhea or skin or rabies, or scabies. You know, it's an acquired infection now, different from what you took down. I hope I've explained myself. Okay? Any other question? Time is off. Any other question? Don't forget the assignments. Comparison between health care, health quality, quality health care and process improvements. Comparisons between quality health care and process improvement. That is the assignment. Good day.